When we think about pain in neurology, we often think about neuropathic pain. And personally, I see a lot of patients who have peripheral generators for those symptoms of neuropathic pain, but central neuropathic pain is an issue too. For our listeners, what should they know about the differences between those two and the treatment approaches to those?
Yeah, so we fortunately have two wonderful articles, one of them from Dr. Charles Argoff looking at central neuropathic pain, another one looking at peripheral neuropathic pain from Doctors Misha Baconia and Victor Wong. And one thing that I think is really interesting about central neuropathic pain is that for these same patients, we don't need to only be thinking about the central neuropathic pain alone, and not everything that they're experiencing is going to be central neuropathic pain, because they can have frozen shoulder. Post-stroke shoulder pain is actually a really big deal. Of course, you need to be concerned about things like sacral decubitus ulcers in so many of these patients. And so they can have nociceptive components in those same patients, and us as neurologists taking care of these very complicated patients need to have our eyes open for the central neuropathic components, but also in those same patients, the other pain generators that we can do a lot for.